Welcome to Enhancing Transition of Care Communication. My name is Emily Weisenbeck, and I am completing a PGY1 at Mayo Clinic. Today I have with me my co-resident, Sarah Norman, and Jennifer Dipple, who is completing a PGY1 resident for healthcare in Milwaukee. Shali Alendri will be giving a second webinar that goes hand in hand with this one, titled Best Practices, Enhancing Transition of Care Communication. Today's webinar is designed to describe how hospitals, long-term care facilities, and community pharmacies can improve communication across the care continuum. This webinar addresses barriers behind transition of care communication and provides some strategies on how to overcome these barriers. The use of different medication therapy management interventions in the community pharmacy will also be discussed to help enhance transition of care communication. Those viewing this webinar program will be eligible to receive 0.75 hours of education credit for this activity. CE will be granted to those individuals that view this webinar, complete the learning assessment questions on this course webpage, complete the evaluation, and select Claim Credit online. CE will be uploaded into participants' CPE monitor portals within 60 days of claiming credit if the CPE monitor ID and birth date in the month-month day-date format are provided. Questions about CE credit should be directed to the PSW office. The other presenters and I have no disclosures to report. After listening to this webinar, you should be able to explain what the hospital and community pharmacy roles are in improving transition of care for patients. You should be able to identify at least 5 methods to overcome common barriers to quality care transitions, and you should be able to describe medication therapy management services in transition of care. First, I will introduce the Pharmacy Practice Model Initiative, and I will explain the different roles for both hospital and community pharmacies and patients. Then Sarah will how you can overcome implementing a transition of care process. And finally, Jen will discuss how MTM services can fit in care. The goal is to improve the transition from hospital to community pharmacy for a patient. By improving this process, we hope to enhance patient engagement, improve medication use, reduce prescription drug costs for patients and payers, and improve communication between pharmacy providers. We also hope to reduce hospital readmissions and enhance patient quality of life. PPMI, or Pharmacy Practice Model Initiative, empowers the pharmacy team to take responsibility for medication use outcomes. To provide some background, the goal of the pharmacy and team integration, leveraging pharmacy technicians, promoting pharmacist credentialing and training, encouraging appropriate use of technology, and taking leadership in medication use. The Pharmacy Quality Collaborative, or more commonly known as WPQC, is an initiative to connect community pharmacists with patients, physicians, and health plans to ensure safe and high-quality care to patients and to reduce the costs of medication use. Now I will begin to cover what transition roles are for hospital, community, and patients. The hospital pharmacist would provide a discharge, which would include an updated medication list to the patient's discharge pharmacy. By discharge pharmacy, I am talking about the pharmacy that will be receiving discharge patient. The goal of this additional information sent to the community pharmacy is to improve the transition of care process for patients and other healthcare providers involved in the patient's care. The discharge summary will serve as a communication handoff from the hospital pharmacist to the community pharmacist. This is a list of important information that should be included in the discharge summary that is sent from the hospital pharmacist to the community pharmacist. Important information to include is patient name and date of birth, admission and discharge date, the patient's primary care provider, the discharging physician and contact for questions, the reason for the hospital admission, a current medication list notating any changes that were made during the hospitalization, allergies, pertinent labs, upcoming appointments, and then an optional notes section where the hospital pharmacist can free text in any additional relevant information for the community pharmacist. For specific details on what this discharge summary might look like, I will refer you to a second webinar, Best Practices Enhancing Transition of Care Communication. That webinar will go into detail on what each section of the discharge summary should include. In the ideal situation, this information would be generated easily and pulled from the electronic health record and should only require the hospital pharmacist to add information to the notes section that's optional. The role of a community pharmacist is to assess the discharge summary sent from the hospital pharmacist. This discharge summary can be used to update the patient's pharmacy information. The discharge summary can also be used by comparing the patient's prior to admission medication list with their discharge medication list, and by providing consultation any relevant notes that were from the hospital pharmacist. Summary will help community pharmacists determine WPQC transition of care and CMRA opportunities. The community pharmacist should educate patients discharge summary with all of the pharmacies they use if they are using multiple pharmacies. Community pharmacy technicians and pharmacy students also have an important role. They can assist in identifying eligible patients. Care can help schedule patients for these appointments. And finally, they can help enter information from the electronic health into the prior to a patient's appointment. As pharmacists, we can help empower the patient to take an active role in their health care. We can encourage patients to use one pharmacy. However, if patients are using multiple pharmacies, we can encourage them to notify their other pharmacies about recent changes in their health condition. This can be accomplished by the patient bringing a copy of the discharge pharmacies, or community pharmacist could offer the discharge summary to the other pharmacies. Another good idea is to encourage patients to bring a copy of the discharge summary to all upcoming visits to enhance collaboration among healthcare disciplines.
Next, we are going to talk about some potential barriers you may encounter utilizing the transitions of care discharge handoff. Some of the potential barriers you may encounter include limited time or resources within your pharmacy, discharge information to do when the discharge medication is inconsistent with the patient's current options. You may also encounter patients who use multiple pharmacies and instances when information is not sent in a timely manner. Lastly, there may be a question where the transition of care discharge handoff fits into health insurance portability and accountability or HIPAA regulations. Let's discuss possible ways to overcome or dispel these. Discharge information may be that they lack the resources necessary to properly use the information. To overcome this barrier, we encourage you to incorporate the pharmacy staff into the transition of care process. Depending on your workplace, this may include residents, interns, pharmacy. Potential roles for these caregivers described earlier, another great reason is the patient themselves. Easy viewing can help empower the patient to take an active role in their own health care. Another option for pharmacies is of a pharmacy handoff sent to complete a medication reconciliation before the patient arrives at your pharmacy. This means that the patient's medications are accurate and up to date will save time run. If the discharge information contains an antibiotic not receive the prescription for, you can contact and have it sent over before it arrives rather than when it is waiting. Lastly, performing a medication reconciliation at the CMRA to be scheduled for a later date. Less preparation will be required for the CMRA as the reconciliation will have been completed. The discharge provided in the pharmacist discharge handoff communication can be used for several purposes. It is essential to educate all pharmacists working at the so that it is utilized appropriately. We encourage you to develop a plan for your pharmacy to use the pharmacist discharge handoff communication that you receive. The discharge information can be used for many care. It can be used to perform medication reconciliation prior to dispensing medications to the patient. This improves transition of care by ensuring that the patient is receiving the current medications at the time of discharge. It can also be used to help the pharmacist with prescription consultation or in conducting CMRAs. Please refer to the Best Practices Enhancing Transition of Care Communication webinar for more information on how to use this information. The Transition of Care Pharmacist Discharge Handoff Communication is meant to enhance the patient's care transition from the hospital to the home or other care setting by decreasing uncertainty about and discrepancy in medication. There will doubtless still be occasions when the discharge medication list does not match the written prescriptions. For example, the patient has a previously written prescription for metoprolol succinate 50 milligrams daily, but the discharge medication list states that the patient should be taking metoprolol succinate 100 milligrams daily. What do you do in this scenario? Remember that the discharge medication list provided in the pharmacist discharge handoff communication is not considered a prescription order. When discrepancies are identified, you will need to collaborate with the hospital pharmacists and physicians to make the necessary changes to the prescription. Collaborative practice agreements would be the exception to this rule. Under a collaborative practice agreement, you may be able to make changes based on the discharge medication list without contacting the provider. Don't for level 1 interventions when discrepancies are identified. One patient may use pharmacies for their scenario is a patient who uses mail order pharmacy for chronic medications and a local for acute medications such as antibiotics. The pharmacist discharge communication handoff will only be sent to the pharmacy that receives a discharge medication order. It is very important to encourage your patients to provide other pharmacies with their discharge summary. The patient may choose to bring or send the discharge summary to their other pharmacies, or you may offer to fax their discharge summary to the alternative pharmacies. Whichever method you and the patient decide to use, it is vital that the patient is sharing their discharge information with all their pharmacies in order to receive optimal transition of care. The pharmacist discharge communication handoff template will be sent by the hospital pharmacist at the same time or soon after the discharge medications are sent. Depending upon the electronic health record used at the institution, there is the possibility that this may be automatically transmitted at discharge. Otherwise, summaries may be sent in several ways, including communication or via fax. Pharmacy and institution to determine the optimal method of communication if you are not receiving discharge summaries in a timely fashion. There is concern that sharing patient information with discharge communication violates HIPAA rules and regulations. However, be assured that this is not the case. Transition of care, which involves coordination and care between healthcare providers and the disclosure of protected health information, falls under the continuation defined with medication.
Next, we are going to be discussing how medication therapy management services can be used to enhance transition of care. Why is medication therapy management needed? Well, medication-related problems and medication mismanagement are a large health problem in the United States. Research has shown that 1.5 million preventable adverse events occur each year that can result in approximately $177 billion in injury and death. Medication therapy management, or MTM, is used to describe a broad range of patient care services provided by the pharmacist. These services are designed to improve medication use, patient safety, and reduce healthcare costs. Pharmacists provide medication therapy management services in all care settings where patients take medications. The ultimate goal of pharmacists providing medication therapy management is to make sure that the medication is right for the patient and their health conditions, and that the best possible outcomes from treatment are being achieved. Through MTM services, pharmacists collaborate with providers and patients to enhance therapeutic outcomes. Anyone who uses prescription medications, non-prescription medications, herbals, or other dietary supplements may potentially benefit from medication therapy management services being provided by pharmacists. Those that may benefit the most include patients who use several medications, who have several health conditions, those who have questions or problems with their medications, those who are taking medications that require close monitoring, those who have been hospitalized, and those who obtain their medications from more than one pharmacy. Benefits from medication therapy management services include improved medication use, improved patient safety, reduced healthcare costs for both patients and payers, reduced hospital admissions, along with the partnership between pharmacy teams, physicians, and patients to streamline quality transition. Medication therapy management services can be billed if the patient has eligible insurance providing reimbursement for these services. Certain insurance companies utilize different MTM platforms to bill for these services. Outcomes MTM, Aprexis, are three different MTM service platforms available for pharmacists to bill MTM services. MedImpact, Humana, and iCare are insurance companies that use Outcomes MTM service platform. Forward Health, Healthcare, and Network Health, three payers or insurance companies, use the Aprexis, Caremark, ECI companies that use to assist in billing for services. Wisconsin Forward Health, the only insurance provider that has transition of care, medication review and assessment, or CMRA interventions. All other insurance providers offer general CMRA interventions with follow-up visits. To this in a few slides. Through WPQC, Wisconsin Forward Health offers level 1 and interventions. Through level 1 interventions, these can include therapeutic cost effectiveness interchange interventions, which may come up with a formulary interchange, or if you notice a therapeutic interchange possibility with your patient, you can bill for those. If you are providing a medication device education for a new medication device being prescribed to a patient, or if you have a patient and you notice an incorrect administration technique with the medication device, or if the patient requests a medication device education, or if the prescriber is requesting it, you can then bill for that level 1 intervention. Or level 1 intervention could also include dosage form, or that a medication dose is supratherapeutic. You can bill for that. If you notice subtherapeutic, you can also bill for that. Also, if you notice that the doctor has prescribed for an insufficient duration or quantity, if the is supposed to be taking a pill twice a day and the doctor only wrote for a quantity of 30, that's only going to get the patient through a 15-day supply. To see, and then go ahead and make that adjustment, and then you can also bill for that intervention as well. Medication addition or medication deletion can also be billed if you notice that medication is inappropriate for the patient, or if the patient would benefit from another medication according to clinical guidelines. And then finally, focused adherence is another level 1 intervention that you can be billing for through MTM. And this if you notice the patient is picking up their prescription early, if they're picking up their prescription late, by simply providing that form of education with the patient and motivational interviewing with the patient, you can then bill for that service as well. Level 2 interventions are also billed through WPQC Wisconsin Forward Health. And level 2 interventions can include medication, also comprehensive medication review and assessment follow-up appointments, and finally transition of care comprehensive medication review and assessments as well, which can really be helpful when it comes to patients being discharged from the hospital, medicating from the hospital pharmacy. So what is a comprehensive medication review and assessment, otherwise known as a CMRA? A comprehensive review and assessment is a private face-to-face visit between the pharmacist and the patient, or sometimes even the patient's caregiver or advocate. These can include a general medication review, comprehensive medication review. The purpose of a CMRA is not just to identify medications to dig in a little deeper. We will acknowledge the patient's medication therapy concerns, to discuss or identify potential side effects of medications that the patient is taking, raise the patient context, to identify barriers to patient therapy that reduce their level of adherence, whether it's cost or maybe even side effects. We should analyze the patient's vital signs in laboratory to confirm that it's appropriate. To screen for high-cost recommendations for cheaper alternative therapy. As well. The overarching goal for a medication review and assessment is to make sure the patient's medication therapy is safe and effective for the patient, and verifying that the patient's goals of therapy are currently being caregiver that's discharged from a hospital or a long-term care facility covered by a participating payer such as Wisconsin can receive a medication review and assessment service, as long as the service is provided within 14 days of discharge. The service can be performed each time the patient experiences a discharge from a hospital or a long-term care facility. It's important to keep in mind that this is a standalone service that does not have any follow-up visits included with this service. Conducting a transition of care CMRA, a level 2 comprehensive, can be completed in 3 easy steps. Over the next few slides, I will discuss each of these steps to help you successfully complete a transition of care comprehensive medication review and assessment. The first step of conducting a transition of care comprehensive medication review and assessment includes preparation. One of the first steps that you should take in preparing for your transition of care in and Policy Override Center, otherwise known as the DAPO Center, to receive prior authorization of the Level 2 Transition of Care CMRA service. As part of the transition of care CMRA preparation process, you should review the patient's discharge medication list to compare the patient's prior to admission medication list, and if you need to, by even contacting the patient's home pharmacy to get a more accurate prior to admission medication list. You also need to review the medications that the patient was taking during their hospital stay, along with the medications that were prescribed upon discharge, in order to determine if the discharge medication list is appropriate. From this information, you should be analyzing the therapies that have been continued, discontinued, or modified, along with any unnecessary or duplicate medications that have been prescribed. You should be reviewing medication interactions that were identified, along with reviewing the patient's medication history to verify that there are not any gaps in care upon this transition. And the patient's laboratory data should also be determined to determine if the correct dose and the medication are being prescribed. The second step in performing a transition of care CMRA involves performing the CMR. During this step, have the patient sign the WPQC consent form at the beginning of the consultation for the pharmacy to keep on file to prove that the patient provided consent for these services. During this consultation, you should educate the patient on any new or discontinued medications, on new or changes in over-the-counter or supplemental therapies, on dose or direction changes, educate the patient on medications that were prescribed that have a future stop date, such as any antibiotics, along with those medications that may have taper schedules, such as therapies similar to prednisone. Medication device instruction is also important, especially for patients prescribed new devices such as inhalers, blood glucose monitors, insulin pens, or even syringes. It's important to educate our patients as well in regards to what side effects they need to monitor for and how to avoid those side effects. Toward the end of the consultation, the patient should be provided an updated medication list. A hospital discharge medication list would serve as an appropriate discharge medication list that the patient could take home with them upon discharge on that same day that they were discharged. The final step of the transition of care comprehensive medication review and assessment involves closing the communication loop. The transition of care CMRA involves sending a final medication list to the patient's primary care provider, primary pharmacies. The patient should also be contacted within 2 weeks after the transition of care CMRA medications or dose changes that were made when the patient was discharged. This will also give the patient an opportunity to ask any questions up since they The transition of care CMRA intervention is a standalone service, as I previously mentioned, that can be provided to Wisconsin Forward Health patients after each hospital or long-term care facility discharge. This is a separate service that is provided to patients discharged from a hospital or a long-term care facility within 14 days. There are currently no follow-up comprehensive medication review and assessment services that are included with the transition of care CMRA intervention. If a follow-up CMRA service is necessary for a patient that recently received a transition of care CMRA, these patients should still be eligible to receive the general CMRA and 3 follow-up services provided through the Wisconsin Forward. For those patients that may require another comprehensive medication assessment intervention after they receive the transition of care CMRA intervention plans as previously discussed, including those with Wisconsin Forward Health. As I previously mentioned, CMRAs involve a private consultation and the patient, and this includes a CMRA, the general CMRA, along with the transition of care CMRA that I just discussed. And through these services, we are enhancing the patient's medication therapy concerns. We want to be able to identify side effects of medications that the patient is taking and ways the patient could avoid those side effects. We want to be able to identify barriers in the patient's medication therapy that reduce their level of adherence, whether it's cost or side effects. During these consultations, we should be analyzing the patient's vital and laboratory values to confirm that the therapies they're taking are appropriate It's important for us to be screening for high-cost medications and providing recommendations for cheaper alternatives, and finally analyzing the patient's immunization status and making immunization safe. Payers require certain eligibility criteria for level 2 interventions. Criterion includes multiple prescription medications to treat or prevent chronic multiple conditions, the use of providers, a recent discharge from hospital or long-term care setting, low health literacy, or illegal referral. At the end of each CMRA, the patient should receive a medication action plan and an updated personalized medication list. The medication action plan will address any recommendations that you have for a patient and any recommendations that you will communicate to the patient's physician. The personalized medication list is an updated list of the patient's current medication therapies. A medication action plan and a personalized medication list can be given to the patient before they leave the pharmacy or clinic, or they can be mailed to the patient after the appointment, depending upon how much documentation needs to be completed for each patient. An example of a medication action plan and a personalized medication list template can be found on the PSW WPQC website. Any identified during the CMRA should be addressed with the patient's physician and the patient's provider, along with the patient's home pharmacy. They should be contacted to inform them of the CMRA intervention that was completed. When significant concerns arise during the consultation, it is important to consider referring the patient to see their physician for follow-up care. If any interventions were identified to start, stop, or change any doses of the patient's medications, send a message to the patient's doctor requesting the appropriate recommendations. As previously stated, when you complete a comprehensive medication review, it is important the follow-up, but you also should be following up with the patient as well. Within 2 weeks after the comprehensive medication review and assessment is completed, contact the patient telephone to follow up to see how everything is going. But you also want to follow up on the recommendations that you made from the provider. If you haven't heard back from the provider based upon the recommendations that you did submit to the provider, contact them again to see if they received the initial recommendations. Also, follow-up visits should be completed as needed for patients to prevent any adverse drug events and to also monitor for any medication efficacy, safety, and adherence measures. WPQC, Wisconsin Forward Health, does allow for 3 follow-up CMRA visits in addition to the initial CMRA that you already completed. In comparison, both Outcomes and Marixa do not offer any follow-up appointments. If you are interested in more about the Pharmacy Society of Wisconsin Pharmacy Practice Model Initiative Enhancing Transition of Care Communication, please refer to the following web links. Thank you for taking the time to help enhance transition of care communication. This webinar was made just for you by the Pharmacy Society of Wisconsin Pharmacy Practice Model Initiative Committee.